welcome back to my YouTube channel. Today I'm going to talk to you guys about money. So I must say, getting paid as a nurse practitioner varies in state, varies by the county you live in, varies by a lot of other factors, right? So I'm going to talk about it from my perspective, okay? There's other people who might differ from me, but that's their experience, okay? So the question that a lot of people say to me is, oh, you're a nurse, so you must make money. Or they'll say, oh, you're a nurse practitioner, so you must be making a lot of money. Well, I'm not going to say that I'm not happy with my salary. I am eternally happy and grateful. However, who don't want to get paid more money? I think that I should, but I'm going to tell you, how it works for me. So, actually, now I must say that you remember before I had told you guys, it's in another video, that I work currently as a nurse practitioner outside in the hospital, and in the hospital I work in an administrative role. I want to tell you that in my administrative role, I get paid more than what I get paid in a family practice setting. Now, people would say, oh, why do you do that? Why would you want to get paid more as administrative? Why don't you climb that administrative ladder? You do whatever you're passionate about, and you do whatever works for you and your family. Right now, I do not want to be sitting on my phone responding to email 5 days a week or whatever. So I choose, and I have a passion for taking care of people. So this is my path of which I want to follow right now. And that's the good thing about being a nurse. There's many different avenues that you can take. So to go back on track, in my administrative role, I get paid more. And I want to give you the ranges. Granted, I've been a nurse for over 13 years. And you should expect, with that amount of years of experience, I'm going to give you a range. And the reason why I'm giving you a range is because for some people who might be a nurse the same amount of time that I am, they might be getting paid a little bit more or a little bit less. It just depends on the organization that they work in. So with 13 years of experience, you should expect that as a RN, you should be getting paid anywhere between $40 and $55 an hour in Miami, Florida. Granted, in other states, your mouth might be like, what? I'm not gonna get paid that little bit amount of money, because I have a girlfriend of mine that is getting paid in the 70s. She lives in a different state, okay? So currently in Miami, Florida, that's the range that I know that nurses are getting paid in a med-surg setting. Med-surg nursing. I didn't talk about any other specialty. I'm only talking about myself, right? Then, as a nurse practitioner, I'm telling you this, that from my experience and my friends, currently it ranges from anywhere from $40 an hour. I've even seen someone take $38 an hour, right? To $65 an hour, okay? And I must say this, sometimes you have to look to see, are you working in a clinic? Are you working in a specialty area such as maybe renal or cardiac? Are you seeing patients in rehab? And also you have to look to see on your volume of patients that you're seeing. In a family care setting, depending on whether or not you're working a full 8-hour shift or not, some providers that you're partnering with would want you to take a minimum of anywhere between 12, and I've even seen nurse practitioners who are seeing 20 patients for the day. So You have to look to see what is your job responsibilities and kind of see how many patients you're seeing and the amount of documentation. So to recap, what's the salary for a nurse practitioner here in Miami? It ranges, coming out of nurse practitioner school, anywhere between $38 an hour, this is from my experience, to $60 to $65 an hour. Okay? So if it's something that you're considering doing, there you have it. Okay? Thank you guys. I hope my information that I provided to you was, brought increased knowledge to you. Thank you guys for watching. Subscribe and ask questions. And do you remember what I told you before in the last video? Click the subscribe button and share. Please, 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 please share my video. All right? Thank you. Nurse Shelly on duty. Bye.